Hello everyone, my name is Kholood Almatrafi, a master degree in public health. So today I will present for you the systemic review about the determinant of telemedicine utilization. So I will start about background and research problem. Rapid growth of telemedicine. Telemedicine developed from a limited innovation into key method of healthcare delivery during COVID-19. Its use increased significantly across different specialist and care settings. Although clinical effectiveness was proven, its integration before the pandemic was inconstant. Although access increased, difference in the telemedicine use continued. Studies show lower use among older adult, racial and ethnic minority groups, and people with lower socioeconomic state. These results indicate that increased access alone doesn't generate awareness in healthcare. Current research study factors affecting telemedicine use at the patient, provider, and policy level. However, only a few studies combine these factors with one clear theoretical model. This separation limits a full understanding of the different levels that influence telemedicine use. So the aim of this study, this systemic review aimed to synthesize empirical evidence on the determinant of telemedicine utilization using an expanded multi-level framework grounded in the Anderson behavioral model. The objective is to clarify structure and innovation drivers of telemedicine use and inform equitable digital health implementation. The Anderson model explains healthcare utilization as a function of predisposing factor enabling a resource need-based factor. Conceptual contribution. This review expands the Anderson framework by integration, individual level determinant, provider and organization, policy level determinant. This multi-level science advances a more comprehensive understanding of telemedicine utilization. And the method. This study was conducted as a systemic review following PRISMA 2020 guideline. Methodological heterogeneity across study narrative sciences approach was adopted. Search strategy. A comprehensive search was conducted in PubMed, Scopus, Web of Science. Search term combined telemedicine-related keyword with utilization determined only peer-reviewed English language study were included. And the study were included of the examined determined predictor barriers of or facilitator of telemedicine utilization, a two-stage screening process. Title, abstract, and full text review was applied. The result and study characteristic. Inclusion study, a total of 47 studies met the predefined inclusion criteria and were incorporated into the final sciences. Study design. The evidence-based reflect substantial methodological heterogeneity include observation and cross-sectional study, cohort study, systemic review and meta-analysis, policy analysis, and qualitative investigation. Observation design were the most relevant. Geographical and temporal distribution. Most studies were conducted in the United States, particularly during the COVID-19 period 2020 and 2022. This counteraction may limit generalizability to other health system contexts. So the multi-level determinant of telemedicine utilization, individual level determinant, telemedicine utilization was strongly influenced by demographic and socio-economic factors, including age, race, educational, and digital literacy. And the provider and organization level determinant adaptation varied based on workflow, integration, technological readiness, and organization capacity. Policy level determinate regularity, flexibility, and reimbursement parity were critical structure drivers of telemedicine expansion. Discussion and theoretical implication. Multi-interaction of determinate telemedicine utilization is not driven by isolated patient characteristic, but by dynamic interaction across individual, organization, and policy level. Policy reform shape organization, which in turn conduction patient-level engagement. While many studies examine predisposing, enabling, and need-based factors, few integrate them within a structured multi-level framework. This review reconceptualized enabling resource across level construct operating at both individual and structural level. From expansion to equity, this is a bit rapid pandemic-driven expansion persist disability highlights the limit of regularity chains alone. Sustainable telemedicine integration required coordinated policy aligned situational readiness and digital inclusion strategies. In conclusion, the telemedicine utilization is shaped by interconnected determinant across individual, organization, and policy level. Expansion during COVID-19 demonstrated telemedicine transformed potential but also revealed resistant structure inequity. Regularity, flexibility, and reimbursement parity are fundamental for sustainability, yet insufficient to ensure equality access. Organization readiness, workflow integration, and clinical engagement are critical for long-term institutionalization. Sustainability, telemedicine integration require coordinate cross-level alignment between policy, organization, and community. Thank you for all.